I'm Sophia. I'm from the 7th grade from the same Horizon. And today I will talk about the damage of electrocution and on the human body. Types of electrical injuries. These are the burns of the contact points, entry and exit marks, electrical blocks, lightning burns, and the secondary thermal burns determined by clothes setting on fire. They are the most often affected. People with the ages between 15 and 44-year-olds and 20% children affected by the low blood pressure and minute watchers often exceeding 2000 Celsius and electrocution, a severe disruption of cellular electrical potentials with maximum risk of cardiac and neuronal damage, but also thermal and mechanical changes. Characterized by the development of a current with an immense intensity, 1200 to 200,000 amperes, over a very short period of time. As a result, the central and the peripheral nerve activity is deeply affected, and long periods of lack of breathing and cardiac arrests occur. Usually, the skin lesions are not severe, corresponding to the areas of the electric discharge. Classification of electrical shock. First degree electrotrauma, muscle spasms without loss of consciousness. Second degree electrotrauma, muscle spasms with loss of consciousness. Third degree electrotrauma, loss of consciousness, heart problems, and respiratory problems. And the fourth degree electrotrauma of the contact between the source and the body, the contact surface. The bigger it is, the bigger risk it has, and the route of the electrical cleaner through the body. In case of an electrical shock, there could be the following body damage: tissue death, trauma of the body, vascular damage, muscle injuries, bone damage, and damage to the nerves and the cardiovascular, breathing, musculoskeletal, visual, renal, auditory, and gastrointestinal systems. The most dangerous complications are the ones that start late, involving the cardiovascular system, the central and peripheral nervous systems, and the eyes. Heart rate problems can initially exist in 10 to 30% of cases. Complications can occur to 6 to 9 months after the injury. The peripheral nerve injury can occur up to 3 years after the injury. And because it is a new theme for the and there is some English words that
determines the severity of an electrical pulse.
The current intensity, the current voltage, the tissue conductivity, the body resistance, the root of the body, and its resistance.
Why is lightning injury dangerous?
Because the central and the peripheral nervous systems are damaged, and it can also damage the nerves and a lot of other systems.
What is electrocution?
A severe eruption of with a high voltage with maximum risk of damaging a person or something that gets in its way.
We have got a lot of medical terms in your presentation. I would like to ask you a few of these words. So what is blood pressure?
Blood pressure is the pressure that numbers the pressure of the blood in the system.
What is an adipose tissue?
An adipose tissue is a conductivity tissue with cells called adipose.
Lightning.
This is an element of the nature that can produce an electrical shock.
What is electrocution, our keyword?
The eruption that can damage or kill a person with electrical A thermal burn, it is an injury caused by excessive heat.
Okay. What is a lightning burn?
A lightning burn, it is an injury caused by lightning strikes, which are characterized by a unique pattern.
What is muscle spasm?
This is something that occurs when your muscle forcibly and involuntarily contracts and you can't relax.
Gastrointestinal system.
This is the way it leads the digestive system, which the food goes in your body.
And one more, what's the current intensity?
The current intensity, it is the quality of the charge of intensity that goes through your body.
And a peripheral nervous system?
It is the system outside your brain and your spinal cord.
Wonderful. Thank you, Sophia.
David Dmitrenko and Olescu Luca from 7th grade from Horizontal CM Chișinău.
And today we will be presenting a project about cardio-respiratory resuscitation for adults, a stage of basic life support. Definition and purpose. Cardio-respiratory and cerebral resuscitation represents a set of measures aimed at restoring and maintaining the body's vital functions, breathing and circulation.
Assessing the state of the patient's consciousness. Step 1. Make sure that you, the patient, or anyone else at the scene are safe. Gently shake his or her shoulders and ask them how they are. Are you okay, or how do you feel? Can you hear me? Check if the victim responds to stimuli.
If the victim responds, observe reaction, verbal responses or movements. Avoid moving the victim unless necessary. Examine the surroundings and check for additional information. Check for possible injuries. Call for qualified help. Call for 112. And regularly monitor the patient's pulse and breathing.
One-sided safety position. It is only applied to people who are unconscious, breathe spontaneously, have irregular pulse, and do not present traumatic injuries of the spine. The victim must not remain on the same side for more than 30 minutes, therefore periodically carefully turn the victim on the other side. Vital signs are reassessed every 2 minutes.
Freeing the airways.
Anterior subluxation of the mandible, opening the oral cavity, revision and removal of foreign body.
Assessing the breathing. Detecting breathing with a simple procedure. To determine if someone is breathing or not, follow these 3 steps to keep the airway open and appreciate the presence of breathing. Firstly, look for rib cage movement. Secondly, listen closely to the oral cavity for the presence of breath and feel the movement of air in your face. This process should not take more than 10 seconds. Afterwards, you can make a decision on whether the patient is breathing or not.
In cases is lateral septum position taken.
When the patient is unconscious, breathes spontaneously and has a regular pulse.
Airways.
The passage through which airways?
Xiphoid process.
The region formed by the rib cage, thorax,
Okay. Rib cage.
The bony part inside the
chest.
in the region of the chest.
Resuscitation, the keyword.
The activity of bring someone back to life or walking them.
Sternum,
Sternum.
The breastbone.
the breath valve. Circulation,
The movement of
the movement of blood to your blood vessels and through the entire body.
okay. Cardiac arrest,
When the heart stops breathing.
okay. Subluxation,
a partial dislocation.
okay. Vertebromodulary,
Referring to the spine or the region near the spine.
to assess,
So make a decision based on the information.
okay, that's right. Cardio-respiratory resuscitation, also a keyword. Cardio-Respiratory resuscitation.
Helping the patient breathe through the activity of the maneuver.
Yes, bravo. Artificial ventilation.
Helping the patient breathe if they are unconscious or they can't through chest compressions.
Okay. And one more, let's say trauma.
Past injury.
Thank you. One.
We have to hyperextend the mandible, then we have to subluxate it, and then we check if there's any foreign bodies.
For patients with a history of previous traumas, we use the double S-mark hybrid maneuver, and we don't hyperextend the neck. We grab him here and open the mandible to check if there is any foreign bodies on a flat surface and kneel beside them. We hyperextend our arms and place them on the sternum, avoiding ribcage pressure. Then we interlock our fingers and hyperextend our hand at a 90-degree angle on the sternum to start sternal compressions.
The compression depth should be 5 to 6 centimeters for adults or for children that are above the age of 8. If they're under the age of 8, the compression depth should be 4 to 5 centimeters. The compression should be done at a frequency of 100-120 per minute.